In this lesson, we're going to talk about policymaking. Policymaking is important to understand when studying healthcare systems because it is through public policies that healthcare systems are created, implemented, and reformed. So in this lecture, we're going to go over the policymaking process to get a deeper understanding of how healthcare reform goes from an idea to a policy to reality. There are different types of public policies, and these public policies can be enacted for a number of reasons. When we talk about policies, we're referring to laws, rules, regulations, and informal guidance. But when we talk about policies in this lesson, we are talking about public policies, meaning we're not talking about the types of policies you see in private corporations. We're talking about policies that are enacted by governments. All right, so why are policies enacted? Well, they're enacted perhaps to encourage certain behavior, to discourage or punish certain behavior, or to facilitate or benefit the welfare of members of society. Some policy scientists believe that the rational decision-making model should be how the policy process is carried out. And in this model, we would identify what the policy problem is or what the societal problem is, and we would take a very systematic and rational approach to generating alternatives. And by generating alternatives here, we're talking about policy proposals or solutions. And we would then evaluate these alternatives, and based on the evidence, we would choose the best alternative. We would then implement it, which means carry it out. And once it's been carried out, we would conduct some research to evaluate whether the implementation of the policy resulted in the particular outcomes that we were looking for. Now, Deborah Stone, a political scientist, challenges this rational decision-making model. And she says it's not how the policy-making process actually works. Moreover, Deborah Stone argues that this rational, objective approach, it assumes that all social problems that are identified are objective conditions, and that they're conditions that we then just need to figure out how to measure, and that this can all be done objectively. And she challenges that premise. She says that social problems are defined. Social problems are defined by groups, and groups use stories, and these stories identify what the causes of the problem are. And then they set up the most attractive policy alternatives. Now, she also points out that it doesn't address something that political science refer to as agenda setting. It assumes that the problem objectively exists and that scientists or policymakers are able to identify and measure it, and then that automatically becomes part of the policy process, and it automatically gets addressed. She argues instead that, first of all, we're assuming here that we are worrying about what we should worry about. So the rational decision-making model, if we go back here, assumes that we're going to easily identify the problem. It ignores the fact that there are many problems in society. Society has many different types of problems, and that decisions are made to focus on one problem over the other. And this rational decision-making model ignores the process that occurs before we even pick which problem to worry about. So I'll give you an example. Much of my research is on substance use. And when I started my PhD program, I was one of the few people at Ohio State that was researching substance use treatment and substance use policy. But in about 2014, the CDC, which is the Center for Disease Control and Prevention, they released a study that indicated that there was a large spike in the number of opioid overdoses. All of a sudden, researchers shifted and public attention shifted to focus on this spike in opioid overdoses. Now, if you look at charts of problem drug use or overdoses, you will find that the number of overdoses had been increasing for a number of years. But it wasn't until this report was released that everybody began to focus attention on it. So the rational decision-making model doesn't capture this phenomena, which political scientists call agenda setting. This rational decision-making model also doesn't take into consideration the fact that there are many problems that we ignore, and that the decision to ignore some problems over others is not always based on the scope of the problem, the size of the problem, or any rational calculation. So I would break down the policy process by first talking about the problem definition part of the policy process. In defining the problem, or the problem definition part, involves the following steps. First, there is a decision by society, by a number of persons, or by an influential member of society, that some phenomena is a problem. And it is a problem that the government is best situated to address. So in the case of the opioid overdose crisis, the decision was made at some point, based on the number of people dying from overdoses, that the opioid overdoses were starting to become a societal problem. Then problem definitions of that problem compete. And what do I mean by compete here? I mean groups, I mean individuals. They tell stories, and these stories are backed by evidence. Sometimes, not all the time, sometimes. They tell stories that define the cause of the problem. Deborah Stone calls these causal stories. So going back to our opioid overdose crisis story, so at some point it was decided that the number of overdoses that were occurring were a problem. Then there were congressional hearings where people came and testified. There were expert opinions written, all trying to convince Congress as to what the cause of the opioid crisis was. So some groups argued that it was the increased supply and availability of prescription opioids. There were some law enforcement actors, particularly from the Drug Enforcement Agency, that said the problem is that the Mexican cartels are actively sending over these drugs, and these drugs are causing people to overdose. Usually one definition or a cluster of definitions dominate. So for my dissertation work, I analyzed the narratives that were used to define the opioid crisis in front of Congress. And I found that the narrative that dominated was one that was a more health-oriented narrative that defined the cause of the problem partially as the increased supply of prescription drugs, and the other part was due to lack of access to substance use disorder treatment. So that cluster, that medical model or health-oriented model, was the cluster of narratives that dominated. And because the health-oriented narrative dominated, it limited the type of alternatives available. So if Congress accepts the causal theory that it is increased supply due to an increase in the number of prescription opioids, as well as lack of access to treatment, then the types of policy alternatives available to solve those two problems are limited to health-oriented type of alternatives. And those included, training physicians on how to properly prescribe opioids. They included drug take-back programs so that extra opioids could be safely disposed. They included funding to increase the availability of substance use treatment. But these alternatives or these solutions did not include punitive or criminal justice measures. right? And what is so fascinating about that is in the past, for at least 80 years prior, the criminal justice measures, enhanced sentences, longer sentences, more jail time, were the most favored types of policy alternatives by Congress to addressing spikes in drug use. But this time, for the opioid crisis, that solution was not the one that was chosen by Congress. When I looked at previous drug crises, overdose crises, I found that the groups that were defining the problem in front of Congress were defining the drug user as a deviant, as somebody who controlled their behavior, and as somebody who needed to be taught how to behave better. And that narrative fits with the policy solutions of jail. If we want to deter bad behavior, we increase criminal penalties. So as you can see, the definition or how a problem is defined can affect whether or not it's defined as a health problem or whether it's defined as an education problem, as a criminal justice problem. So the alternatives are limited by the definition, and then amongst those alternatives, a few solutions are usually chosen. Those solutions are then adopted through legislation or another type of policy. And then that, I missed a little step here, which is implementation. Right, so that policy is implemented, then we can try to determine whether or not, by looking at what's called policy feedback, we can try to determine if we need to revise the solution, and then we go back again. So that's why it's a circle, right? You continue to revise the program incrementally until it improves. As far as the actual process that goes into creating and implementing a policy, the procedures could be summarized in this slide. So first, there's the agenda setting, which we talked about, which means deciding what problem is going to get the focus and the attention of the policymakers. Then, based on how the problem is defined and which types of alternatives were accepted, a policy is going to come out. It's going to be formulated. That policy is then adopted. Once it's adopted, it goes into the implementation phase where it becomes a reality. And then there's ongoing administration of that policy. And that is where we have the, remember back to the government lecture, where we have administrative agencies in the government that typically are the ones administering the policy. And this is where we kind of keep an eye out for consequences, unintended or intended consequences, so that we can go back and adjust the policy if we need to. So while evidence, logic, and rationale do play important parts in the policymaking process, so do too ideas and values. So in trying to decide what influences policy, you could begin to brainstorm a number of factors. The media can influence the types of problems that we identify or how we define that problem. A particular event that focuses us on the problem could influence the policymaking process. For example, when a high-profile celebrity dies of an overdose, that can focus us on underlying problems that already existed. There could be cultural influences on policy, right? We talked about how the values and the culture in early United States history, how Puritanism affected the development of social policy, right? So culture can also influence. As too can ideologies or belief systems. The political climate plays a big role, right? What is the political climate like? That can influence the type of policy. Is it an election year? Past policies influence future policies. Past policies influence future policies. We call that path dependence. Because once policymakers go down one particular path, it's really hard to undo that. Oftentimes, we end up just incrementally changing the path, but we continue along the same path. Part of the reasons that policies are path dependent or they rely on past policies is that institutions are created by policies. What do I mean by that? Well, we had past policies that created the Veterans Health Administration. That became an agency that provides health care to veterans. That agency has a long history. There are people that work for that agency. There are patients that have received care at that agency, and it becomes an institution, a fixture. Because it is an institution, there is going to be a lot more pushback if we were to try to dismantle it. And it would be easier to propose policy solutions or alternatives that just go to reform, to improve, or to build on the Veterans Health Administration. So all of these factors and more that I haven't listed here affect how we think about policy problems, and they affect how policymakers act on policy problems. So when you are formulating your final project, and I ask you to consider the values and the social context in which you are creating your healthcare system. These are the types of things I'm asking you to look at. I'm asking you, does it fit within American culture? If not, how would you argue that it does? What ideologies might support it, might be against it? Are there particular events that are going on now, like, that little thing we call COVID-19, that are affecting, that would help you sell your policy idea, right? So you're going to want to think about what influences policies, both in the United States and abroad. So you may be wondering how these policies and institutions came together to create the U.S. health system. Well, it was policies that created Medicare and Medicaid, which then led to the creation of an institution, an agency in the federal government called the Center for Medicare and Medicaid Services, or CMS. It is policies that created this idea that veterans should be able to have health care, access to health care, and that health care should be not only paid for but provided by the federal government, which then created the Veterans Health Administration. It was policies that created grants and to go to what are called federally qualified health centers. And these are centers for persons who don't have health insurance. They can go and get outpatient care. It was through policies that local hospitals were funded. So particularly in the US, it was through a combination of different policy solutions to perceived social problems that resulted in the creation of a health system. Now, other countries may have gone about it differently. We know they went about things differently a little bit than the US, right? They may have had one policy decision that said, we are going to create a national health system, like in Britain, NHS. And then there were many policies that reformed NHS over the years and continue to reform it. So some countries had more of a global plan on healthcare, like Britain. In the United States, we have a fragmented system that are just a combination of policies that have been enacted over the years. So when you're designing your healthcare system for your final project, I'd like you to think about what values you're communicating. What values should we emphasize when designing a health system? We talked about American values have included individualism. And maybe that individualism has trumped this idea of the community. We've also talked about the Puritan influence that arguably influenced the American idea of pulling yourself up by your bootstraps and our dislike for handouts. But then we do have the progressive era, right? We do have a sector of society that blames large corporate firms for individual trouble. So we do have conflicting values. How do these values transfer over to healthcare? Well, we have values of individualism. We have emphasis on our liberties. We hear arguments against national health care by saying, I want to be able to have the right to choose whatever doctor I want to go to. This idea of choice is tied into liberty. I don't want to be subsidizing or paying for the health care of other people. That goes into this idea of individualism. Okay, we're going to wrap it up here, and we will start back again in the next video discussing healthcare values.